No waiting in the cold, no long lines. So-called vaccine hunters say they can make it easier to get a shot in the arm much earlier than waiting your turn.
The ethos behind it is to eliminate vaccine waste.
When Brad Johnson found out doses of the vaccine were being thrown away, he set up a Facebook group in his home city of New Orleans.
I was a little surprised when I learned that so many doses were being thrown away. And that's really what inspired me to make this group, was to prevent that from happening and to try to improve upon the gaps, the failures of our implementation plan, the rollout of the vaccines in our country.
Quickly realizing it was a nationwide problem, he created a website to connect people with groups looking for leftover doses. Mark Sussman and his wife got their spare doses by phoning around their local supermarkets in Washington, D.C.
There were about 10 people that were all in the same queue as us, and we got vaccinated all within about 15 minutes, and we were all just kind of hanging out until closing time at the grocery store there.
So far, more than 10% of the US population has been vaccinated, with the government prioritising the elderly and frontline health workers. With the White House ramping up its vaccine rollout, some people have questioned whether these vaccine hunters are undermining those efforts, whether they're jumping the queue by getting vaccinated before they're eligible. Both Brad and Mark argue that it's better for someone to receive a dose than for it to go to waste, and say instead it highlights the mismanagement of the rollout.
This is just a poor logistical management system.
Medical lecturer Michael Urban made a video to demonstrate the difficulties that he had trying to schedule an appointment for his mother. The official federal website said that there were none available.
The government should look at the fact that if people already developed forums to find out where these vaccines are going to waste, why is the government not stepping in and saying, hey, let's seize those back, take them, and get them somewhere rapidly to where we can get to the people that we need to get to right now? So, over 65, let's get these people vaccinated.
Brad says he's already had inquiries from people overseas wanting to replicate his site in their own country. While the rollout problems persist in the US and abroad, he's determined that no injections go to waste. Nick Harper, SABC News, Washington.